What is the likelihood of getting a false negative result with a SALT pregnancy test?
Hello and welcome to today's video. We're diving into a topic that's intrigued many, the SALT pregnancy test. This at-home method claims to predict whether you're expecting or not, but how accurate is it really? Let's examine the likelihood of getting a false negative result with a SALT pregnancy test.
What is a SALT pregnancy test?
A SALT pregnancy test is an old home-based method to determine pregnancy. The procedure involves mixing urine with table salt and waiting for a reaction. If the mixture forms a creamy, clumpy texture, it's believed to indicate pregnancy. But how much trust can we put in this method?
What are false negatives?
Before we dive into the reliability of SALT pregnancy tests, let's briefly discuss what a false negative is. In the context of a pregnancy test, a false negative occurs when the test wrongly indicates that a person isn't pregnant when they actually are. There are several reasons this can occur, including taking the test too early, not following the test instructions correctly, or the test itself being faulty.
How likely is a false negative with a SALT pregnancy test?
Now, onto the main topic. How likely are you to get a false negative with a SALT pregnancy test? It's difficult to give an exact figure due to a lack of scientific studies on the accuracy of SALT pregnancy tests. However, considering that these tests rely on visual interpretation and lack the sensitivity of modern pregnancy tests, they can be highly susceptible to false negatives and positives. Even in modern, scientifically validated pregnancy tests, the chance of a false negative can be as high as 10% when done early in pregnancy. Given the informal nature and subjective interpretation involved in a SALT pregnancy test, the likelihood of a false negative or positive result is presumably much higher.
Should you rely on a SALT pregnancy test?
Given the lack of scientific evidence supporting the accuracy of SALT pregnancy tests, they should not be used as a reliable method for detecting pregnancy. Modern over-the-counter pregnancy tests, blood tests, and ultrasound scans are significantly more reliable and accurate. If you suspect you're pregnant, please consult with a healthcare provider and use a medically recognized pregnancy test. While it's understandable that you might be curious about home-based pregnancy tests like the SALT test, it's important to rely on scientifically backed methods for accurate results. Remember, a SALT pregnancy test could have a high likelihood of providing false negatives or positives due to its subjective nature and lack of medical validation. If you suspect you're pregnant, seek guidance from a healthcare provider. Thanks for tuning in today, and we hope this video has provided some clarity on this topic.